Hello doctors, have a beautiful day. Today we are looking at the child Turcotte Pugh syndrome. Pugh score. So this is basically it is developed to evaluate the risk of the portocaval shunt procedures, and it is performed for the portal hypertension. It is useful in predicting the surgical risks. So we are able to get information about the surgical risk of the other intra-abdominal operations performed in case of the cirrhotic patients. Now, moving ahead, what are the variables and what are the components of this scoring? Firstly is the bilirubin levels. So it is graded into 1, 2 and 3. So in case of bilirubin level less than 2 mg per TL, it is 1. If it is 2 to 3, it is 2, and if it is greater than 3, it is 3. Next, we're looking at the albumin level. So albumin level, if it is 1 in case of greater than 3.5, it is 2 to 2.8 to 3.5. In case of 2 and 3, it is less than 2.8. Next, looking at the prothrombin time. Prothrombin time is nothing but increase in seconds, and this is seen in case of 1 to 3 in case of 1 point, and 4 to 6 in case of 2 points, and greater than 6 in case of 3 points. Next comes the international normalized ratio. International normalized ratio is less than 1.7 in case of 1, and 1.7 to 2.3 in case of 2, and greater than 2.3. Next, we are looking at the encephalopathy. In case of encephalopathy, it is none for 1 point, and it is controlled for 2 points, and it is uncontrolled in case of 3 points. Next, we move on to the ascites. So in case of the ascites, the 1 point is none, and this is controlled, and this is uncontrolled. So looking at what these scores indicate. So in case of class A, B and C. So class A refers to 5 to 6 points, class B refers to 7 to 9 points, and C refers to 10 to 15 points. So 5 to 6 means it is well compensated, and it has about 10% of mortality. In case of class B, it is 7 to 9 points, it is decompensated, and it is significant functional compromise. So it is about 30% of mortality. Next, we are looking at class C. Class C is say points is 10 to 15 points, and is severely decompensated, and it is about 75 to 80% of the mortality.